in our ability to have the foresight to predict the future. As we speak today, we are thickly into the fourth industrial revolution, called as the IR 4.0, which the foundation of which rests on advanced computing, artificial intelligence, and interdisciplinary collaborations. Knowledge of only one domain today will not see us through. Historically, looking over the previous industrial revolutions, carts gave way to locomotive engines way back in 1870s and 1860s in the first industrial revolution. Small-scale manufacturing gave way to factory line assembly setups in the second industrial revolutions, and postal letters and landline phones gave way to emails and satellite communications in the third telecommunication and computers industrial revolutions. Similarly, in the fourth industrial revolution, with interdisciplinary organization with only one domain knowledge, will be overshadowed by individuals and organizations that have multifaceted domain knowledge and expertise. Those doctors who just have domain specialization of their own specialty probably would be outsmarted by those doctors that would work in tandem and utilize technology, artificial intelligence, statistics, economics, psychology, and so many other diverse fields. So these are the days of interdisciplinary care. It was said that whosoever can untie the Gordian knot will go on to rule the world. Well, Alexander did it not by untying it actually, but he actually cut it with his sword and he opened that knot. And that example is given many times as an innovative, out-of-the-world thinking. And he did go on to rule the world. So creative, innovative, out-of-the-box thinking always has and will always be the forebearer of changes, innovations, and people who have that ability will go on to write history in future. As far as innovation and entrepreneurship ecosystem is concerned, government, both at state and national level, is rolling out many programs. And for the medical technologies and medical device industries, medtech technologies, it's the Department of Biotechnology, Government of India, and organizations like BIRAC that are taking the spear-leading role and trying to help institutes and individuals realize their potential. So realizing this way back in 2018, it was a chance meeting between me and Dr. Amitabh in one of the UPCST meetings where representatives from BIRAC and DBT were also present. We understood the importance of this inter-institute collaborations, and we set on the journey that started first as summer immersion programs where students of IIT Kanpur used to come during the summer vacations and spend 2 to 4 weeks with us. Looking at the success of first program, we have the second summer immersion program, we have a series of hackathon meetings, and finally we arrived and we got funding from Department of Biotechnology in 2022 for the SIB SHINE program. Now SIB stands for School of International Biodesign. Just going back a little bit back into history, the first SIB family started between IIT Kanpur and AIIMS New Delhi. It was earlier known as the Stanford India Biodesign Program, but when Stanford University got divorced from it, it changed its name to the School of International Biodesign. Now we are the second campus here and we call ourselves in the uniqueness SIB SHINE program, whereas SHINE stands for Synergizing Healthcare, Innovation and Entrepreneurship. The program started as full 1-year dedicated residential fellowship programs where fellows from different specialties are selected over a very gruesome selection process spread over 3 to 4 tiers, and then they stay with us for the first 3 months at King George's Medical University, where basic teaching of biomedical innovation and entrepreneurship is taught, as well as the scouting for ideas is done in the clinical immersion phase, and based upon the ideas that they have discovered in medical institutions, they go back after 3 months to IIT Kanpur to realize their dreams in designing, prototyping, and so on and so forth. The concept is to handhold them from ideation to commercialization phase, and the vision of the program is building a dynamic ecosystem that identifies nurtures, matures the next generation of biodesign innovators, and developing disruptive and accessible technology. In the days of globalization, where science and technology have no boundaries, economics has no boundaries, just creating frugal innovation may not be good enough. Of course, we have to create innovative devices and technologies that are cheaper in cost, but they also need to be at the competitive level so that they can match with the technologies and the the skills and the grade of international medical technology. So we made the tagline, "Made in Bharat, made for the world." For medical institution, it was being introduced to a fourth dimension of medical training. The earlier three dimensions of medical training were patient care, medical teaching, and research. We added this another dimension, and that required some degree of groundwork, like making an institute IP policy and other certain groundworks. And this is adding fourth dimension to medical education, that is entrepreneurship and innovations. Of course, we have traveled this journey, and last year, the first cohort joined, and our Honorable Chief Secretary Sahab was the chief guest who gave us words of advice there. And we took in 9 fellows. In the 3 months of their clinical immersion in KGMC, around 150 unmet clinical needs were identified. And in the process of cutting down on them and tailoring down, we finally took 25 of them to IIT Kanpur. We had a series of meetings and hackathons in IIT Kanpur where industry leaders, regulatory leaders, and various experts in the domains of engineering and medical institutions were there. In front of them, these 25 were further tailored down to 7 to 8 ideas that were, and we created a team of 1 faculty from KGMU, 1 faculty from IIT, and at least 1 to 2 fellows in each team take these 7 to 8 ideas forward. As I present you the report card here, 6 of those ideas are advanced working beta prototypes. 3 patents have been filed. 2 startup companies have been incubated, and 1 is also on the way, and we have received few awards and recognitions. Are these achievements something that we are very gloat about or we are proud of? I guess, personally for me, the answer is no. They are satisfying, but there is a way to go. But we have to accept this information with a caveat that an average lifespan of a medical device or technology, howsoever simple it is, from ideation to commercialization, is at least 3 to 5 years, if not longer. So we have to give a little more time for these fellows to bloom. We cannot expect stars in just 1 year. But I would take a pause here. I would like to call upon Himanshi, our program director of SIB SHINE program, herself a graduate of IIT Kanpur, is a master's, and she will take us through the SIB SHINE 1-year journey and also introduce you to the next cohort of SIB fellows. I thank you for your attention.
Thank you so much, sir. A very hearty good morning to everyone who have joined us today. I'm Himanshi, Program Manager from SIB SHINE KGMU team. And as we all are here today to celebrate SIB SHINE as it completes 1 rotation. At this point of time, I feel very happy to mention that SIB SHINE has emerged out not only as a program, but a combination of values. Hello, my sincere apologies. So SIB SHINE has emerged out as a combination of values. It carries the value of innovation, value of curiosity, value of perseverance, and thinking out of the box. What made us identify and locate these values are our group of fellows. So we introduced our fellows to the vast KGMU ecosystem on 3rd of September 2022. In the vast pool of patients and emergencies running at every tick of the clock and trying to keep up pace with our doctors, our fellows have visited more than 23 departments, and they have identified numerous problem statements. They covered all the departments ranging from, hello? They covered all the departments ranging from pediatrics to geriatric mental health. Parallelly, these fellows have also been engaged into training sessions of design thinking, basics of medicine, electronics, hands-on workshops on sensors, meetings with industrialists, design innovators, and medtech enthusiasts with the help of alumni and collaborative ecosystem provided by both the institutes, KGMU and IIT Kanpur. As mentioned earlier, after the clinical immersion, these fellows moved to IIT Kanpur with at least
genetically predisposed, and then what, however, motivated me to build a product that not just gains awareness for women, but also enables pre-screening at home itself at an affordable cost. And that is how Nibra was conceptualized. Now, this is a device, this is a smart pad that can be worn under any garment in any bra and converts it into a smart breast health monitoring tool at your home itself. And for this, we are using artificial intelligence with non-ionizing radiation. And currently, we have developed a very successful POC, which has a specificity of more than 98%. And for this, I was mentored by Dr. Pooja Ramakant from the Endocrine Surgery Department from KGMU, and Dr. Santhan and Dr. Venkatesh from IIT Kanpur. And apart from this, I'm immensely grateful to Dr. Amitabh Bandyopadhyay and Dr. Rishi Sethi for for giving us support and for SIB. Thank you.
thank you, Shreya. Another such project is ACE Lab, a comfortable gripping handle for laparoscopic surgeons, which can be operated by single hand, easing out their skeletal pain. Here we can see how the surgeon is requiring more than 2 hands to operate. And here, this is the product that Zahid has been developing to ease out the pain that they feel after long surgery hours. We all can often relate how doctors ease out the lives of our patients, but Zahid decided to ease out the life of our doctors. Moving ahead, I would like to draw some spotlight on more such projects which we will be able to show live today. So, not giving any more spoilers, I would like to invite Kushagra and Prithu as a team who will tell us how they are helping in improving every walking step of a foot drop patient.
Hello. Uh, Thank you for that kind introduction, Himanshi, and a very warm welcome to all dignitaries and guests present here today. I am Prithu, and this is my partner, Kushagra. So during our clinical immersion at King George Medical University, we visited various departments, but the two of us were specifically drawn towards physical medicine and rehabilitation. In our visit to this department, we observed a little boy who had undergone tendon transfer surgery for foot drop syndrome. When we started reading up about this particular disorder, we saw that foot drop syndrome was something that could be managed very easily. Patients in India were not getting very affordable and accessible management options for this disease. So the two of us decided to work on this project, and we decided to come up with something that the patients could use by themselves and in the comfort of their own home, which would help improve their mobility. With the expert guidance of Dr. Ganesh Yadav and Dr. Anil Kumar Gupta, we were able to make a functional electrical stimulator at the very advanced labs of IIT Kanpur. And we went through multiple iterations to come up with a device that is a wearable device and can detect the movement of the patient. When the patient tries to walk, it specifically stimulates the particular affected muscles and nerves and improves the patient's mobility in real time as the patient is walking. So we hope that this device is accessible to all foot drop patients, and we hope to bring this to market as soon as possible and help multiple lives. Thank you.
Thank you, Kushagra and Prithu. Now, let's welcome Aditya, who would tell us about a device which can help all of us learn how to perform a CPR accurately.
Hello. Namaskar. Good morning to everyone. My name is Aditya Raj Bhatia और मैंने और मेरी टीम ने एक डिवाइस बनाया है जिसका नाम है प्रयास। ये प्रयास एक CPR ऑडियो फीडबैक डिवाइस है। CPR फीडबैक ऑडियो डिवाइस के दो फीचर्स हैं। पहला फीचर कि ये बताता है कि कैसे ट्रेनिंग की जाती है टू डू इफेक्टिव CPR। सेकंड इसका फीचर है कि CPR को मेजर करना है कि हम CPR सही कर रहे हैं कि नहीं कर रहे हैं। CPR एक कार्डियो पल्मोनरी रेसिस्टेशन टेक्निक है, एक प्रोसेस है जिससे कार्डियक अरेस्ट पेशेंट्स को बचाया जा सकता है। सो इस डिवाइस का एजेंडा है टू सेव लाइव्स। सीपीआर है पब्लिक प्लेसेस जैसे कि मॉल्स, स्कूल्स, होटल्स, कैब्स, रेस्टोरेंट्स, फेस्टिवल के महोत्सव, रैलीज, जहां पे हम बेसिकली इफेक्टिव सीपीआर कर सकें, और इस सीपीआर को करने के लिए हमें इस प्रयास की जरूरत है। थैंक यू एवरीवन।
Thank you, Aditya. Indeed, a very useful device. Next, we have Sumit, an electronics expert who has done a lot of multitasking in numerous projects.
Hello, good morning. Am I audible? Good morning. This is Sumit, SIB SHINE fellow from previous cohort. So I have had opportunity to work with different departments at KGMU and IIT as well. So my SIB SHINE idea is the biggest thing I have ever worked on. It is a percutaneous device to deal with coronary calcium. Let's know more about it. We all must have heard about angioplasty that treats the heart blockage. But, and we also know that there are stents which widens the coronary arteries and let the patient feel well. But every third angioplasty patient suffers with a problem of calcification. Some calcium gets deposited circumferentially inside that does not let the stent expand uniformly. So the satisfactory treatment is not given to the patient. If you want to give the patient the satisfactory treatment in one go, the cost would be multiplied by 7. Like in subsidized organizations like KGMU, the angioplasty is being done for 50,000 only. But if you want to provide that extra treatment to the patient to decalcify it, so it will cost 3 lakhs more. So we are working on making a device that will bring the cost down. And so what we did, we took a used catheter from Lari Cardiology. I am working under the clinical mentorship of Dr. Rishi Sethi and engineering mentorship of Professor Ankush Sharma from IIT Kanpur. Can we have the next slide? So we took a used catheter from Lari Cardiology. This is an existing technology which costs 3 catheter, is disposable, single time use, and it costs 3 lakh rupees. So we cut down and we use some facilities at IIT Kanpur. So this is the color microscopic view of that catheter. Then we did scanning electron microscope, which is a big thing to access. I am thankful to Professor Amitabh Bandyopadhyay helping me have access in his department, bioscience and bioengineering, to get the scanning electron microscope. And then I analyze again the used catheter with my own endoscopic camera. So next slide, I'll show you some eureka moments from my workbench. So we can see in the left video, there is a black tube which is acting like a coronary artery, and on which I have coated a layer of calcium. So I'll tell you how does this calcium comes from. लोग कहते हैं कि तेल घी मत खाओ, avoid foods that increases cholesterol, तो blockage बढ़ता है. But you know there is no food that you can avoid to avoid this calcium. Why? Because your own muscles gets converted into bone-like structure, and this calcification comes from there. So you cannot avoid it. It can come from it, but don't be scared. It's very. So again, I'll show you another eureka moment from our workbench. We have produced sonoluminescence inside a balloon. Sonoluminescence is something that has nothing to do with light or electric. Okay. How does it come from? It comes from implosion, not an explosion. So micro water bubbles are created inside the balloon, and when those micro bubbles implode, a sonoluminescence can be seen. So this is how it works. Next, please. So next problem is when I was visiting KGMU during my engineering immersion at IIT Kanpur, I met Dr. Anand Pandey from pediatric surgery. So I will request Dr. Anand Pandey to please join me here. So Dr. Anand Pandey gave me an idea that there is a disease, like one out of every 5,000 babies, one baby born with a problem जिसमें उसके एनस नहीं होते. There is no hole to pass the stool. So what surgeons do, Dr. Anand Pandey is a pediatric surgeon. So what they do, they do a surgery and create a hole. And to create this hole, we need to locate the sphincter muscle, which contracts and relaxes when you So I will request my cameraman to focus the camera on my mobile and get it full screen, please. Yeah, so this video, most of us are from medical field here. So we can see a muscle being contracted and relaxed when we are touching this probe. Okay, so we have made this device. You know, the simple thing that we have got patented is take out the cap, put it on the back side, and the device will be turned on. This is the very novel idea, like putting the cap backside and switching on a device. Okay, and there are a lot more features in this device, like this device can be charged wirelessly. Just have to put this device on this docking station and it will get charged. We don't have any push button, so the water cannot get inside the device. We can dip the whole device into the water, we can get it sterilized, we can change the sensitivity, we can change the intensity, everything. We can get the low battery alarm, we have got an OLED display. Like most of the things that could have been done, we have done with this device. And we have filed its complete patent as well. Let's see the third project, which I am working on. Thank you, sir. Next slide. And this device can also be used in gynecology. I discussed with a gynecologist. She is a very well-established gynecologist, and she told me that this device can have a lot of use cases in gynecology as well. So during the clinical immersion, one idea came with the Department of Neurosurgery. I would request Dr. Ankush Bajaj sir to please join me here. So this idea was given by Dr. Ankush Bajaj sir. He let me see the patients who went through surgery. So there is a disease called, let's meet Dr. Ankur Bajaj. He is a neurosurgeon from Department of Neurosurgery, King George's Medical University. So there is a disease called hydrocephalus. What is hydrocephalus? We have in our brain, cerebrospinal fluid. Let's call it CSF. So CSF is a necessary part. It provides cushioning support to the internal parts of the brain. Sometimes what happens, the CSF is produced more than it is required. And what we have to do, we have to drain
that SHINE and every one of you, it will be, we will be granting it in due course of time. Thank you.
Thank you, sir. So moving ahead, our fellows are able to collect some feathers in their cap. And well, these feathers have dusted some glitter on SIB SHINE as well. The fellows have been participating in pitching and fundraising events, and we have won 2 awards. And all of us know that the journey doesn't stop over here. In fact, the journey begins from here. Now, carrying the legacy forward, keeping the SHINE values alive, this year we have selected a cohort of 7 fellows. We have a mixed cohort of different backgrounds who will be pursuing the clinical immersion phase at KGMU. Now, we also have a small video to know more about our new Cohort-2 fellows.
Welcome to all the fellows for the second cohort of SIB SHINE program, a collaborative program between KGMU Lucknow and IIT Kanpur. I'm sure you will have an exciting time. You will be learning about the clinical needs from KGMU under the able guidance of Professor Nishi Shetty, and then we will welcome you to IIT Kanpur, where you will be getting complete access to all the infrastructure and office space and everything to with the aim to create an AI-powered end-to-end disease diagnosis and prognosis solution that can be used by experts to reduce their burden as well as turnaround time. Thank you so much.
Hi, I'm Darshan Samnikar. I'm a medical electronics engineer by profession. I'm passionate about entrepreneurship and healthcare technology, and this is where I found SIB SHINE as a perfect platform to realize these two together. Through this program, I'm optimistic that I'll contribute significantly to indigenous healthcare technologies that will have global impact. Thank you.
Hello everyone, myself Mohit Pandey. I'm currently a PhD student at IIT Kanpur. Prior to this, I did my BTech from Chemical Engineering Department at IIT Kanpur. Being equally interested in biology and medical sciences, I always felt there is a gap between innovators and practitioners, and I want to use this opportunity to fill in this gap. I'm very excited to be the part of this second cohort, and I know with different perspectives on board and different expertise, we will be able to learn and synergically build different products for the mankind.
Hello, myself Dr. Bhav. I have done my MBBS from Kashmir Medical College, Bhopal. While studying medicine and surgery, I always wanted to create something good. Thanks to SIB SHINE program for making drugs, the users of a stethoscope to make us of an eye contact. That's the beauty of this program. Hopefully together we'll create something new, better for the mankind and the medical field. Thank you so much.
Hello all, my name is Ashmit Verma. I am a recent graduate. I have done my BTech in Biomedical Engineering from Samrat Ashok Technological Institute, Odisha, Madhya Pradesh. I wish to be a part of this program to develop sustained and low-cost medical devices for the people of our country and beyond. And I believe by constant innovation, sustained collaboration, me and all the selected fellows can achieve this task within the duration of this fellowship program. Thank you all.
Hello everyone, my name is Keshav. I did my bachelor's in economics, mathematics and statistics from the university. After that, I did a master in applied statistics and data science from Symbiosis School. I have a work experience as a data scientist and business scientist. I admire the program objective to continuously resolve deeply with my values. By being a part of SHINE, I believe I can contribute meaningfully and grow personally and professionally with the program's objective and making a difference with the broader landscape.
Hey guys, this is Rishabh Kumar and I'm a biomedical engineering graduate from SRM Chennai with a background in R&D. I just wanted to say that I'm extremely delighted to be a part of SIB SHINE program, and I'm pretty sure it's going to be really exciting to be working with the team in creating an innovative yet affordable healthcare product for the people in India. Thank you.
I'm Dr. Rameshwari Singhal.
I am Dr. Ankur Bajaj.
Myself, Oveshi.
Hi everybody.
Sudhir Singh, KGMU.
I am Dr. Manish Kumar Agarwal.
My best wishes.
I wish all the best for this program.
I would like to congratulate.
I wish the new batch of fellows grand success.
Welcome to the House of Opportunity.
We wish best of luck to all the new joining and hope that this program will produce the world-class product. Thank you.
Now, I request all of you to help me welcome our new SIB SHINE fellows. Now I request our fellows and team SIB SHINE to please come up on the stage for a group photograph. stage and share his experience with all of us.
Dignitaries and the guests on the dais, and all my friends, colleagues at KGMU, and Cohort-1 fellows, Cohort-2 fellows, the real heroes of today's event. So I would just like to first say a few things for the new fellows to put it in perspective. So first of all, I should tell you that I'm extremely proud here and to represent the best academic institution in the country for innovation. According to Government of India's NIRF ranking, IIT Kanpur is #1 in innovation. During the COVID pandemic, I think we were the only academic institute to have taken 3 products out to the market. And I'll tell you a little bit about the ventilator project that I was intimately involved with. Every academic institute, many large corporations, they attempted to make ventilator. Their product did not go to the market and ours did. What made the difference? The difference is simple, that on the very first day when we decided that we will make the ventilator, we had a team of 3 doctors with whom we discussed what to be made. And our clinical mentor, Dr. Deepak Padmanabhan from Narayana Hridayalaya in Bangalore, he told our team that either you make an invasive ventilator or do not waste your time. Every other organization, they were trying to make non-invasive ambu bags because those are easier to make. And none of those got the permission to be launched, only ours got the permission. So this is where we get to see the critical importance of clinical input. You may want to make a medical device without proper clinical input, you will certainly go wrong. Second is that in my last 10 years in the innovation ecosystem, I must have interviewed at least some couple of thousand startups. And majority of the startups, they get rejected, and sometimes even after growing, raising fund, they fail because they often end up solving a problem that does not exist. So that is the beauty of the SIB SHINE program, that you will be sourcing the problem statement at the venue from the doctors, from the hospital setting. Therefore, you know that a market exists because the fact that it is being used in a hospital or doctors are feeling the requirement for it, the market exists. You will have prior clinical input. Therefore, the product you will make will meet the clinical expectations, and you will have fantastic infrastructure and technical support at IIT Kanpur. Therefore, the product will be of very high quality. Therefore, these will be truly made in India but for the world products, which is the motto of the SIB SHINE program. Second is that I will educate you a whole lot more in the due course about the incubator of IIT Kanpur, the SIIC. Last financial year, we funded our companies more than 55 crore rupees. So that is the kind of bandwidth and capability that SIIC has. So if you have a good product, you are a good startup, you will get support in every possible manner, including your attempt to going to the market. So that is on the why this is a fantastic program, and I would like to congratulate all of you for getting selected through a very steep competition and joining this program, and I really wish you all the best. You have a lot to look forward to. From the first cohort, you already heard of 4 very good innovations. Even if that is those are the only 4 products that go to the market, that is 50% success rate, while the standard success rate for innovation ecosystem is 10%. So this is how powerful this program is. So you are in very good hand, and you should really look forward to this program. The only thing that I would request you, that please observe
welcome Sri Durga Prasad Shankarji, our Chief Secretary of Government of UP. Good morning, sir. Honorable Vice Chancellor of KGMU, Professor Sonia Nityananji, our guest of honor, and other dignitaries present here. On behalf of Department of Biotechnology, Government of India, I welcome you, all of you, for this second cohort inception program. I'm happy to represent the department here and happy to see the success which cohort 1 students have achieved. A very, very big applause for the cohort 1 students for their success. And congratulations for your selection to the cohorts 2 students. And we have big expectations from you people, and I hope that you will this biomed or biopharma sector, which is very important for our bioeconomy, and our efforts is to facilitate the front runners or the front warriors, the institutes like IITs, KGMU, AIMS and other institutes who are actually leading this war, or we can say war because we are on a war footage working towards this developing our bioeconomy system. As per the Indian bioeconomy report of 2023, our bioeconomy stands at $137 billion in 2022. The target which was set was to reach to $100 billion by 2025. We have achieved it much ahead. And now, based on that performance, the target has been revised to $300 billion by 2030. And this target can be achieved only if we all are working collectively towards it. Department of Biotechnology is a facilitator, but actual people who are working towards achieving this goal are people like you, the young innovators and the mentors who are working towards this field. Biopharma sector, which includes biopharmaceuticals, medical devices, medical technology and diagnostics alone, contributed almost $48 billion, that is 36% to this bioeconomy target. So we are an important share to this thing. And to achieve this target, Department of Biotechnology is running the small program Biodesign. In addition to that, our BIRAC is having various schemes like I4, PACE, BIG, SIBRI, and both Department of Biotechnology and BIRAC together are working towards supporting this medical devices and diagnostic ecosystem in India. So this ecosystem has led to making of 1,391 new biotech startups in 2022 alone. And out of these 1,391, 115 startups were from Uttar Pradesh. Uttar Pradesh stands 5th in that ranking, so that's a big achievement. And this has led to 50 cutting-edge products in the biomedical sector in the market in 2022 alone. And it's not only the government who is working, the very important push for it comes when private equity and venture funding comes into it. And it's a big achievement that in biotech industry in India, there was an infusion of $938.8 million through private equity and venture funding. So that's also a good initiative that private sector is coming into this funding. And I think that will increase further. And for that, we need to show that, okay, this sector has a lot of potential. Biodesign program, it was first designed, or we can say conceptualized by our late secretary, M.K. Bhanji, who initiated this program in 2008 with the view that most of the biomedical products or biomedical devices which we are using in India, almost 80% of them are imported. There is a need that we indigenize these products, we innovate these products. India being a different, we can say, market, or even the needs of the people here are quite different from rest of the world. So we need some products which are indigenized. We need some products which are economical, which can address our local problems. So that's why we need the local innovators. And these local innovators need training. Not only training, our innovation system is such from very ancient times that we have innovators, we have products. we can see that there are, if you go even to the school level competitions, we can see that the students are coming with innovative products. What's the problem? They are not coming to market. The reason being, there are not proper studies, hand-holding and market analysis. So to that effect, biodesign centers provide a comprehensive environment where we have mentors who are leaders in their areas, like the people who are present here, and my respects to all of you, from people from KGMU and IIT Kanpur. You are leaders in your area. You know that how these technologies work. You are very good mentors. And with you are the innovators like these SIB fellows. So these innovators, they have spark in them. They are full of new ideas. They know how means they can take up any challenges. And this team of the mentors, enable mentors, and these ignited minds creates a very good teams, and you are creating new product. Product creation not enough. We have to take that product to market. So biodesign centers are also providing that support. They are providing the market analysis, what are the potential of taking that product to the market. So some of these products are also seeing the light of the market. They are being commercialized, they are transferred to the companies and are coming into the market. Because that's the goal we are looking at. It's not only development of product. That product should reach to the people from whom we are designing that product. The fruits should come. That should be the target. So to the Cohort-2 students, this is a suggestion that whatever you are planning, your ideas would be very, very innovative. But very important aspect is that idea should not die. That idea should see the market. And for that, it's very important to discuss. And discussion not only among your cohort. We have 6 biodesign centers. So try to interact with other biodesign centers also, because everyone is working in somewhat different environment. They might have some more experiences or experiences different from you. So learning from each other experiences would help you. So try to be more interactive, and I'm sure that the team of Biodesign Center, Dr. Sethi and Dr. Bandyopadhyay, they will lead you through this, and you will shine in this SHINE Center. This, one of the other important hurdle in this area was IP, filing patent. Earlier, Government of India, especially in the Biotechnology Department, we had a policy that IP was shared by Department of Biotechnology also, and in this, the government mandated a non-exclusive license. That was a big hurdle. Dr. Sethi and Bandyopadhyay would agree to it. And the issue was that when you are going for a non-exclusive licensing, many of the companies were not interested in taking their license. They wanted exclusive. So after a long fight, and with the efforts of my seniors, Dr. Kalyavani Ganeshan, who is the program division head, and Dr. Alka Sharma, and our enable leader, Dr. Rajesh Gokhale, the secretary of the department, a new IP policy has been drafted, under which now Department of Biotechnology does not take any claim in the IP you are developing. We are facilitators, we are supporting you, but we are not asking any claim in the IP. The IP resides with the host institute. So the IP is now for KGMU and IIT Kanpur. That way, you can use your own guidelines, you can make your own guidelines, and you transfer that IP. You can go ahead with non-exclusive, you can go with exclusive, or you can go with IP assignment. It's the rest on you. So that way, we are trying to facilitate this ecosystem as much as possible. And a new feather to this program, which has recently been added, is this World Intellectual Property Organization, WIPO, that has partnered with Department of Biotechnology, IIT Delhi Biodesign Center, and IIT Bombay. And we have initiated a WIPO International Global Health Innovation Fellowship, in which now international fellows will come and study under these fellows. So right now the program has started in IIT Delhi and IIT Bombay, and I'm sure it will expand to other centers also in future. So now when this program started, our fellows were going to Stanford. They were going outside for the training. It was Stanford International Biodesign. Now we are doing this reverse training. We are getting the students, international students, to India for this, and that's a big achievement of this biodesign program, and that speaks of the success of this biodesign program. And that success is because of all you people. So thank you for driving this program, and I hope that this will go further. Thank you.
Thank you, sir. Now, I may please request our Honorable Vice Chancellor Ma'am to express her thoughts, which would really motivate our fellows for their journey ahead.
Chief Secretary of Government of UP, Dr. Abhishek Mehta from the Department of Biotechnology, Dr. Amitabh Ban. Since UP government representatives are here, I would like to bring out that KGMU doesn't want to stop here. We want to develop our own incubation center, an incubation cell, and this cell will not just be for clinical immersion of innovative ideas, but the way we want is that it will be a prototype validation center also, with the vision of helping out all the medtech companies to validate their technology, which were, you know, your drive for these projects, you know, for developing startup technologies, etc. I reviewed a lot of them, and I pointed out, you know, to Dr. Kalaivani that one thing which was which I found inadequate was their joining hands with medical institutes. So you develop a technology, but you need a robust medical system to validate these technologies. So our incubation center, the way we envision is that it will of course be for the immersion of innovative ideas, clinical immersion of innovative ideas, but we would also like to develop it as a prototype validation center because of the goldmine of clinical material which is there in KGMU. At the same time, we will request the UP government to give us at least two officers, two innovation officers, one with a background of medtech engineering and one with a background of medical data sciences. So that will be very good for our incubation center. Again, I wish all the new inducted fellows good luck, great hopes from all of you, and many congratulations to the 9 fellows for their outstanding work. I would also like to thank the Department of Biotechnology for their financial support and the IIT Kanpur for the wonderful collaboration. Thank you, and thank you our Chief Secretary, who himself is an IIT and Kanpur alumni, to be here to grace the occasion. Thank you very much.
Thank you, ma'am. Now I would like to invite our Honorable Chief Guest, Shri Durga Shankar Mishra Sir, to deliver his words of wisdom for our audience, fellows, and entire KGMU.
किंग जॉर्ज मेडिकल यूनिवर्सिटी के वाइस चांसलर डॉक्टर सोनिया नित्यानंद जी, SIB SHINE प्रोग्राम के एक्जीक्यूटिव डायरेक्टर प्रोफेसर IIT कानपुर प्रोफेसर अमिताभ बंदोपाध्याय जी, डिपार्टमेंट ऑफ बायोटेक्नोलॉजी के प्रोग्राम डायरेक्टर डॉक्टर अमिताभ मेहता जी, यहाँ के KGMU की डीन एकेडमिक्स डॉक्टर अमिता जैन जी, डॉक्टर राजकुमार जी, यहाँ पर मौजूद KGMU के एवं IIT के अन्य प्रोफेसर्स, फैकल्टी मेंबर्स, स्टूडेंट्स और हमारे कोहर्ट 2 के नए नवागंतुक आविष्कारक कोहर्ट 1 के, जिन्होंने अभी अपनी कुछ तमाम सारी अच्छी बातें बताई कि कैसे क्या क्या किया है, आप सबका मैं अभी आज SIB SHINE के दूसरे एक संस्करण के लिए आप सबका स्वागत करता हूँ। मुझे SIB SHINE यानी स्कूल ऑफ इंटरनेशनल बायो डिज़ाइन, सिनर्जाइजिंग हेल्थ केयर इनोवेशन एंड एंटरप्राइज, इसको 2022 सितंबर में, मुझे ख्याल है सितंबर 2022 में इसे शुभारंभ करने का सौभाग्य मिला था। तब आपसे मैंने बहुत विस्तार से चर्चा की थी और आज उन 9 बच्चों को देख करके, उनके काम को देख करके इतनी खुशी हो रही है कि ये हमारा नया भारत है। बिटिया श्रेया नायर ने जिस प्रकार से बताया कि उसने क्या इनोवेशन किया है, कैसे हमारी महिलाओं की जरूरत जो कि वो इग्नोर करती हैं और धीरे धीरे छोटा सा बीमारी बड़ी बीमारी में परिवर्तित हो जाता है, तो उसका ये इनोवेशन मैं तो आशा करूंगा कि बहुत जल्दी ये मार्केट रेडी हो जाए, मार्केट में आ जाए, जिससे तमाम सारे महिलाओं की क्वालिटी ऑफ लाइफ इंप्रूव करे और उनकी ज़िंदगी लंबी हो। इसी प्रकार से जाहिद ने जिस प्रकार से एक कैसे बाकी लोग तो पेशेंट्स के बारे में सोच रहे थे, वो डॉक्टरों के बारे में सोच रहे थे कि डॉक्टर जब सर्जरी करते हैं तो उनको कितनी तकलीफ होती है, और उसको सोच करके उन्होंने ऐसा कुछ डिजाइन किया कि उन्हें रेस्ट मिल सके, उनका काम आसान हो सके। थैंक यू जाहिद, इट्स अ गुड थॉट एंड यू हैव टू मूव फॉरवर्ड, इसके आगे बढ़ना है। जो प्रयास के माध्यम से आदित्य ने सीपीआर के बारे में एक नई किस्म की सोच, एक नया किस्म की चीज की, कैसे हम सीपीआर जो हम स्कूल में पढ़ते थे तब सीखा था हमने, लेकिन सीपीआर सही तरीके से है, उससे बहुतों की जिंदगी बच सकती है। अभी हाल में एक घटना हुई आईआईटी कानपुर में, प्रोफेसर बंदोपाध्याय है, प्रोफेसर राजकुमार यहाँ पे है। अभी हाल में घटना हुई, हमारे एक बहुत ब्रिलियंट प्रोफेसर आईआईटी कानपुर में, वो एक्स स्टूडेंट जो फॉर्मर स्टूडेंट थे उन्हें भाषण दे रहे थे, और उसी के दौरान वो एकाएक उन्हें हार्ट अटैक हुआ एंड नियत उनको अपने साथ ले गई। तो ऐसे में अगर सीपीआर सही से दिया जाए और समय से दिया जाए, क्योंकि द गोल्डन आवर इज फर्स्ट फ्यू मिनट्स, तो उस गोल्डन आवर में अगर कर दें तो शायद उनकी जिंदगी बच सकती है, बहुतों को लाइफ मिलेगा। ऑल द वेरी बेस्ट आदित्य। और सुमित ने जिस कॉन्फिडेंस के साथ 2-3 चीजों की बात की, आई वाज रियली, आई मीन सो मच हैप्पी टू सी द लेवल ऑफ कॉन्फिडेंस, चाहे वो हार्ट के बारे में हो, चाहे ब्रेन के बारे में हो, अलग अलग चीजों के बारे में। और मुझे पता चला कि पहला उसका प्रोडक्ट तो पेटेंट होने जा रहा है, पेटेंट के रास्ते पे है। सो दिस शोज द न्यू इंडिया, ये नए भारत को दिखा रहा है। और धन्यवाद है डिपार्टमेंट ऑफ बायोटेक्नोलॉजी को कि जिसके माध्यम से इस प्रकार का एक नया प्रयास, इसमें हमारे देश की एक ओल्डेस्ट, वन ऑफ द ओल्डेस्ट, 1905 में स्थापित हुआ केजीएमसी, 118 साल पूरा कर चुका है और अभी भी पूरी तरीके से, पूरी मजबूती के साथ आगे बढ़ रहा है। ये बताता जी कैसा इसका भविष्य। केजीएमयू और दूसरा आईआईटी कानपुर, मुझे बताने की जरूरत नहीं, मैं तो वहाँ का प्रोडक्ट हूँ, किस प्रकार की टेक्नोलॉजी पे काम होता है, दोनों मिल करके एक नई किस्म की संस्कृति को पैदा कर रहे हैं। ये नई संस्कृति अगर आप पीछे मुड़ करके देखें तो 2014 में जब माननीय प्रधानमंत्री जी ने देश की बागडोर संभाली थी, तो हमारे देश में कुल गिने चुने 100 के आसपास, मुझे ख्याल है 100 या 150 स्टार्टअप्स हुआ करते थे। आपको जानकर के खुशी होगी कि आज हमारा देश दुनिया का तीसरा सबसे बड़ा स्टार्टअप हब है। आज हमारे देश में लगभग 1.5 लाख 1.5 लाख स्टार्टअप्स हैं और हमारे देश में 100 से ज्यादा यूनिकॉर्न है। ये हमारे देश की एक नया इकोसिस्टम, मुझे तो देख करके खुशी हुई। जब मैं आईआईटी कानपुर में पीछे जाता हूँ, जब हम पढ़ा करते थे तो सारे बच्चे सोचते थे कि अमेरिका चले जाएंगे, ज्यादातर लोग पढ़ाई करते थे अमेरिका की और फिर कभी लौट के नहीं आए। यानी वो देश के एक सब्सिडाइज एजुकेशन प्राप्त करते थे, पब्लिक के टैक्स से वो सारा का सारा उनका एजुकेशन होता था। बहुत हम लोग की फीस बड़ी नॉमिनल हुआ करती थी और वो पढ़ाई करके सीधे अमेरिका चले गए और वहां के लैब में वहां और ऐसी ऐसी वैक्सीन बनाई जो कि दुनिया में सबसे ज्यादा, हमारे देश में तो 200 करोड़ से ज्यादा लोगों को मिली, दुनिया भर को यहाँ से सप्लाई किया गया और लोगों में विश्वास जगा कि देखिए भारत की वैक्सीन है। हमारे समानांतर जो अन्य वैक्सीन खड़े थे उनसे हम आगे, उनसे उसका जो लोगों के प्रति विश्वास ज्यादा जगा, क्योंकि हमारा देश के अंदर एक आविष्कार की ये क्षमता है, ये सोच है। अगर आप सोचिए भारद्वाज मुनि का, सोचिए अब भारद्वाज मुनि का तो नाम तो सुना होगा कि जब भगवान राम जा रहे थे वन गमन को तो भारद्वाज मुनि के आश्रम में रुके और उनसे उन्होंने शिक्षा ग्रहण। लेकिन भारद्वाज मुनि ने आज जो एयरक्राफ्ट का इन्वेंशन हुआ, हम तो राइट ब्रदर्स को जानते हैं, लेकिन पूरा का पूरा विमान शास्त्र लिखा भारद्वाज मुनि ने। वो एक उनके आश्रम में इतने सारे लोग शिक्षा भी लेते थे और तमाम सारे विषयों के ऊपर जो कार्य करते थे और वैज्ञानिकता पे काम करते थे। कणाद मुनि का नाम सुनिए, कणाद मुनि के बारे में कई सारी बातें आप सुनते होंगे। और आज जो एटॉमिक जो एटम के बारे में जो हम सोचते हैं वो कणाद मुनि ने उस समय लिखा हुआ था। उसके तमाम भास्कराचार्य का सोचिए, गुरुत्वाकर्षण के बारे में हम तो न्यूटन के सेब की कहानी सुनते हैं, लेकिन भास्कराचार्य के आप उसको पढ़ें तो उसे गुरुत्वाकर्षण, इन सारे हमारे ऋषि संत जो थे वो इतने बड़े वैज्ञानिक थे कि वो भाषा के ऊपर भी, विज्ञान के ऊपर भी, कृषि के ऊपर भी, दर्शन के ऊपर भी वो तमाम सारी बातें किया करते थे, क्योंकि ये सब चीजों का जो एक सबका एक सम्मिश्रण होकर के एक साथ मिलकर के काम करते थे। हमारे देश में समय के साथ हम अपने आप को भूल गए थे। हजारों साल की गुलामी, हजारों साल का जो हमारे दूसरों का हमारे पर जो छाया रहा, आधिपत्य छाया रहा, जिसके बारे में पंच प्रण में माननीय प्रधानमंत्री जी ने 5 प्रण दिया आज़ादी के, जो 15 अगस्त 2022 को उन्होंने लाल किले के प्राचीर से, उसमें एक प्रण है कि हमारे मन से वो गुलामी की मानसिकता खत्म हो जाएगी। अगर हम गुलामी की मानसिकता को खत्म करेंगे, अपने धरोहर, अपनी शक्ति पर एक बार विश्वास करना चालू करेंगे, तो फिर आप सदैव देखेंगे कि आप में उन्हीं संतों की ताकत, उन संतों की जो प्रतिभा थी वो हमारे अंदर फिर से प्रज्वलित हो जाएगी। और जिसका जीता जागता उदाहरण मैंने कहा कोविड-19 नहीं, मैं 50 एग्जाम्पल दे सकते हैं कि आज कैसे हम लोग चंद्रयान के माध्यम से ऐसा कुछ किया जो दुनिया नहीं कर सकती, दुनिया ने नहीं किया। ऐसा बहुत सारे फील्ड्स में आज जो, जैसे मैंने कहा कि पिछले 10 सालों में जो देश में एक नया परिवर्तन आई है, नई जागृति आई है, नई सोच और नया उमंग और नए एस्पिरेशंस डेवलप हुए, वो इसका फर्क आया। और इसीलिए जो हमारे पूर्व प्रधानमंत्री लाल बहादुर शास्त्री जी ने कहा था जय जवान जय किसान, तत्कालीन माननीय प्रधानमंत्री अटल बिहारी वाजपेयी जी जो यहाँ के हमारे सांसद भी थे, उन्होंने उसमें जोड़ा जय विज्ञान। और हमारे प्रधानमंत्री जी, जो प्रेजेंट प्रधानमंत्री जी ने उसमें उन्होंने जोड़ा कि जय जवान जय किसान जय विज्ञान और जय अनुसंधान, यानी देश में इनोवेशन की संस्कृति डेवलप हो, नई नई चीजें हम लोग पैदा करें और उस नई चीजों के माध्यम से ये हम सबसे पहले तो मेक इन इंडिया, यानी भारत में हम उसको पैदा करें, भारत के लिए हम पैदा करें और देन प्रोड्यूस फॉर द वर्ल्ड। क्योंकि जो भारत में इतना बड़ा जो मार्केट है, इतनी बड़ी सारी जनसंख्या है, इतने सारे लोगों पे जो आप काम करते हैं, उस अनुभव से आप उसको दुनिया को दे सकते हैं। हम लोग जो है इंपोर्ट की जगह पॉजिटिव एक्सपोर्ट करेंगे, क्योंकि दिस इज द नॉलेज इकोनॉमी। ये ज्ञान का क्षेत्र है। उस ज्ञान के क्षेत्र से हम नॉलेज इकोनॉमी से हम बहुत कुछ चीजें दुनिया को दे सकते हैं। और दुनिया हमसे अपेक्षा भी करती है, बहुत सारी चीजें अपेक्षा भी करती है कि वो तमाम सारे देश, आज जैसे यहाँ पे स्वच्छ भारत का काम हुआ, तमाम सारे देश सीखना चाहते हैं कि हमने क्या किया, कैसे किया। आज जिस प्रकार से जल क्रांति हो रही है, हर घर में नल जल हो रहा है, आज तमाम सारे देश सीखना चाहते हैं कि हमारे देश में क्या हुआ, कैसे हुआ। जो कोविड के दौरान जिस प्रकार की हमारी व्यवस्था हुई, लोग सीखना चाहते हैं क्या करें, क्योंकि देश हमारा, इसमें हमारे अंदर ताकत है, उन संतों की, उन ऋषियों की जो ताकत है। और उस ताकत को जब हमने एक बार महसूस किया, जब गुलामी की जंजीरों को हमने अलग किया, तो फिर हम अपनी ताकत को स्वतः ही महसूस करते हैं। ये जो हमारा नया कोहर्ट बना है 7 का, मैं भी हमारे बगल में मेहता साहब बैठे थे, मैं पूछ रहा था कि आपने कितने लोगों का यहाँ पे दिया है, लक्ष्य दिया है। इन्होंने बताया 8 दिया है, बट यहाँ पे केवल 7 बच्चों को कोहॉर्ट 1 में लिया गया। मैं बंदोपाध्याय साहब से गुजारिश करूंगा कि पिछला कोहॉर्ट जब 9 का था उसमें 2 हमारी बेटियां थी, इसमें सातों के सातों इसमें कोई बेटियां नहीं। आपने देखा श्रेया ने क्या कमाल किया, उसने सी हैज द सेंसिटिविटी फॉर द विमेन, और विमेन हमारे लिए मातृ शक्ति। आज हमारे माननीय मुख्यमंत्री जी मिशन शक्ति कार्यक्रम चलाते हैं पूरे प्रदेश में, जो आज महिलाओं का जिस प्रकार से उद्भव हुआ है, जिस प्रकार से तेज आया है, जिस प्रकार से हर क्षेत्र में उनका जो अनुभव आ रहा है, हर क्षेत्र में, आज चाहे वो मिलिट्री हो, चाहे पुलिस हो, चाहे विज्ञान हो, चाहे कोई भी क्षेत्र हो, हमारा आज राजनीति हो, प्रशासन हो, पुलिस हो, सब जगह आपने जरूर एक बहुत रिगरस सिलेक्शन प्रोसेस से किया होगा, लेकिन मेरी सिफारिश होगी कि इसमें एक बिटिया को तो जरूर रखिए, क्योंकि उनसे एक नया, उनसे एक वो सोच आती है, उस सोच को आना आवश्यक है। जब हम अनुसंधान करेंगे, जब हम नए किस्म का जो विचार करेंगे, तो वो भाव उसमें आना आवश्यक है। अगर कर सकते हैं इस पर जरूर आप विचार करें। और जो बच्चे यहाँ पे, और मैं उनसे कहूँगा कि मैं सारे 7 बच्चों से कहूँगा कि अब आपको इतना बढ़िया माहौल मिला है, एक तरफ IIT कानपुर जैसा जो दुनिया के जो हमारे प्रौद्योगिकी के जितने संस्थानों में एक उच्च स्थान रखता है, KGMU जो कि अगेन मेडिकल क्षेत्र में इतना बड़ा स्थान रखता है, जो कि वह हिंदुस्तान के टॉप मेडिकल कॉलेजेस में आता ही नहीं, बल्कि दुनिया में आप कहीं भी जाएंगे, आप जब डॉक्टर से बात करेंगे तो पूछेंगे कि क्या बैकग्राउंड है, तो KGMU, अन्य तो KGMU वालों ने उनको पढ़ा के बनाया, KGMU का कहीं ना कहीं उसकी छाप होगी। IIT कानपुर का, मैं तो देश भर में, मैं चूँकि भारत सरकार से तमाम सारी जगह जाता रहा, जहाँ भी जाता था वो हमारे IIT कानपुर के, हमारे IIT के जो बहुत सारे अलुमनाई मिलते हैं। ये पूरा दुनिया भर में दर इम्प्रिंट आप सब जगह धन्यवाद इसलिए कि आपने मुझे मौका दिया कि मैं आकर के इनकी अच्छी चीजों को देखूं और मैं आपसे सीख रहा हूं, आपसे भी सीखता रहता हूं। हर जगह मुझे कुछ कुछ सीखने को मिलता है, नई नई आइडियाज हमें आती हैं। तो आपको धन्यवाद इस बात के लिए और बधाई इस बात के लिए कि आप जो देश में एक माहौल बना है नया चीज करने का, नवाचार करने का, नवाचार के माध्यम से हमारे उत्तर प्रदेश के, ये मेहता साहब ने बताया, यही नहीं बल्कि उत्तर प्रदेश स्टार्टअप्स को बहुत प्रमोट कर रहा है। हमारी अपनी खुद की पॉलिसी ऐसी है कि स्टार्टअप्स को हम लोग कैसे प्रमोट करें। बहुत सारे हमने इंक्यूबेशन सेंटर बना रखे, हर एक यूनिवर्सिटी में हम लोग बना रखे और उनको हैंड होल्डिंग करते हैं कि जिसके माध्यम से वो आगे जाके मार्केट रेडी बने और मार्केट में आए, क्योंकि हम चाहते हैं कि इसके माध्यम से न केवल हमारे नागरिकों के जीवन में सुधार हो, उनका जीवन उनका और उच्च गुणवत्ता का बने, पर साथ ही साथ हमारी अर्थव्यवस्था में इजाफा हो, क्योंकि आप जो काम करेंगे उससे अर्थव्यवस्था में भी बहुत तेज इजाफा होगा। तो मैं आप सबको अपनी शुभकामनाएं देते हुए, नए साल की भी शुभकामनाएं देते हुए अपनी वाणी को विराम दूंगा। धन्यवाद। जय हिंद, जय भारत।
Thank you so much, sir. Thank you very much for your kind words. And we truly take your suggestions and start working henceforth. Now, I would like to request, on behalf of KGMU, I would like to request our Honorable Vice Chancellor, ma'am, to kindly present a small token of thanks to our Honorable Chief Guest of the event. I would request Dr. Sethi to please present the token of thanks to Honorable Vice Chancellor, madam. I would like to request our small SIB SHINE team to present the token of thanks to our esteemed guests on the dais. Now, as we conclude this event, I may please request Dr. Sudhir Singh to deliver a vote of thanks on behalf of entire SIB SHINE team.
थैंक यू हिमांशी। किंग जॉर्ज चिकित्सा विश्वविद्यालय के ऐतिहासिक सभागार में उपस्थित समस्त विभागाध्यक्षों, अधिकारीगण, आज के कार्यक्रमों के नायकों पृथु, कुशाग्र, जाहिद, आदित्य, श्रेया, अक्षय, अश्मित, दर्शन, मोहित, शिवांक, हिमांक, शिवेश और ऋषभ, आप सभी की उपस्थिति में मैं गर्व और आनंद की अनुभूति के साथ धन्यवाद प्रस्ताव ज्ञापित करते हुए आज के कार्यक्रम के मुख्य अतिथि, मुख्य सचिव उत्तर प्रदेश सरकार श्री दुर्गा शंकर मिश्र जी का हार्दिक आभार व्यक्त करता हूं। मुख्य अतिथि जी, ये आपके कुशल प्रबंधन और कार्य दक्षता का परिणाम है कि आज उत्तर प्रदेश उत्तम प्रदेश का स्वरूप और आकार ले चुका है। अपने कार्यक्रम की अति विस्तृत हमारे कार्यक्रम में आपकी गरिमामय उपस्थिति किंग जॉर्ज चिकित्सा विश्वविद्यालय के लिए आपके अनुराग और स्नेह का परिचायक है। हम समस्त केजीएमयू परिवार आपकी उदारता के ऋणी हैं और कामना करते हैं कि आपका आशीर्वाद व कृपा हम पर सदैव बनी रहेगी। कार्यक्रम की विशिष्ट अतिथि माननीय कुलपति किंग जॉर्ज चिकित्सा विश्वविद्यालय आचार्य सोनिया नित्यानंद जी, आपके व्यवहार में सरलता और सहजता, ये दोनों देवी गुण आपका आभूषण है। किंग जॉर्ज चिकित्सा विश्वविद्यालय के समस्त क्रियाकलापों में आपकी गहन रुचि से प्रभावित हम सभी आशान्वित नहीं, अभी तो विश्वस्त हैं कि आगामी वर्षों में चिकित्सा सेवा, शिक्षा, शोध तथा सामाजिक उत्तरदायित्व सभी क्षेत्रों में हम नित नूतन सोपान चढ़ते उच्च मान स्थापित करने में सक्षम रहेंगे। मंचासीन विशिष्टगण, भारतीय प्रौद्योगिकी संस्थान से आचार्य जय कुमार जी, जैव तकनीकी के क्षेत्र में, श्री अभिषेक मेहता जी जैव प्रौद्योगिकी के क्षेत्र में, शैक्षणिक संवर्ग अधिष्ठाता आचार्य अमिता जैन जी सूक्ष्म का शुक्रिया। जिन किसी का नाम ज़बां पे आ नहीं सका, उनका दिल से शुक्रिया, और दिल भी जिनके लिए छोटा पड़ गया, उनके रूह से शुक्रिया। शुक्रिया, धन्यवाद। थैंक यू ऑल।
हिमाचुना गंगा उच्चल जलधितरंगा, तव शुभ नामे जागे, तव शुभ आशीष मांगे, गाहे तव जय गाथा। जन गण मंगलदायक जय हे भारत भाग्य विधाता। जय हे जय हे जय हे जय 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 हे।
I request everyone to please proceed for the high tea.